Hidden in the beauty of Guatemala are the faces of so many. The Mayan people are hardworking. However, over 71% live in extreme poverty on less than $1 per day. Project SALUD Y PAZ was created in 2001 and provides over $1 million worth of free and low-cost medical and dental services each year to rural Guatemala. In an area of the world where children and families suffer and die of easily treatable conditions, the staff and volunteers at Project SALUD Y PAZ are changing lives.
My name is Juanto, and I am the assistant, a general assistant of this clinic. One thing is that a lot of rural people, Mayan people, who lives like this area, that it's really hard to get to the city because it's so expensive, and they can't afford it to do that. So it really helped this clinic because not only we speak the language, we know the people, and also they trust the doctors who come here.
My name is Tomasa Perez. I'm so happy to have this opportunity to share what this clinic has done in my life.
We had a surgery team from Florida come in, and they were doing OBGYN surgery. Tomasa came in and she needed a hysterectomy done. But unfortunately some complications developed after the surgery was over, and she began to bleed and bleed profusely. And so we needed a blood transfusion, and we did not have any blood on hand. And so the situation began to get critical.
It's kind of hard because we don't speak the language, so we just trust the doctors. I went for the surgery and I didn't feel a thing until I woke up. I felt very weak, and the doctor told me that I needed blood. After I had the transfusion, I felt different, like I had a new life. I have a part of this person with me, the person who donated the blood, and I'm so thankful for that.
We had one of the nurses from the volunteer team that sat down, and we hooked up, and we did a direct blood transfusion from the nurse to our patient Tomasa. And because the volunteer was willing to give of her blood, Tomasa's life was saved.
That's why I'm here. I'm alive because of this clinic. I'm so happy to tell you that this clinic has changed my life. My name is Martina Mejia Morales. I come from Joya Baja, a village about 5 hours from here. I heard about the clinic and I came to get medicine. That's why I brought my child here. A member of my family had surgery here last year, so I came to see if they could help my little boy. This is my first time here as a mother, but I've seen patients that have been treated here, so I'm hoping that they can change my little baby's life.
So here you can see we have a beautiful young Mayan boy who has a bilateral cleft lip. If we didn't have Project SALUD Y PAZ here, this child might very well grow up and spend their entire life with this cleft lip and palate. We have teenagers, young men and women who still have cleft lips and palates. Fortunately, next month we'll have a team of surgeons here who will be able to treat this young boy and repair this birth defect so that the child can nurse, have proper nutrition, and can grow and have a normal life.
Within a week, they'll actually have that palate totally healed all the way across. It's an amazing thing to watch.
Founded by Dr. Phil Plunk, SALUD Y PAZ meets the medical needs of the Mayan population by providing health, healing, and education for the people of Guatemala.
We have patients that live as much as 200 kilometers away, so sometimes they come here by bus or they walk. Sometimes they have to come the day before and sleep over so that they can be sure to be seen the next day. We don't just give the medicine, we also try to educate them. People would die definitely if the clinic were not here. Even if the cases are not that bad, they wouldn't get the medicine. They don't have money to go to a private clinic, and the government will not help either.
When opportunity is not possible, it's hard to imagine making the choice to learn and succeed. Manuel is a man with just such a dream and started working chairside, training to do dental work. His son, Hector, is assisting him and hopes to follow in his footsteps.
I want to do what my father is doing. I'd like to become a licensed dental technician here in Guatemala This would not be possible if Salud Y Paz were not here in Camancha. I would not be able to afford to go to school if my father did not have a job here.
Breaking the cycle of poverty starts with the children. Salud Y Paz operates a preschool where young children can get a healthy start on life.
Our preschool is a program that is for 5 and 6-year-old children in the Camancha community, and we provide breakfast, lunch, and a snack 5 days a week for our students.
Most of the children don't have enough food at home in order to be in good health, and that is making a quality difference.
The purpose of our program really is to help the students kind of get a jump start. They speak Quiche in this area.
One of the major problems that we see in education is that the parents don't have the right resources, the economical resources to bring the children to school.
A lot of the children were dropping out within their first couple of years of primary school. And of course there's a lot of reasons why that happens. That has to do with living in poverty and especially in a poor, isolated community. They have a vitamin drink called Incaparina, which they have every day as a snack with a piece of fruit. And so right now the children are about to have snack. They have been working on an art project. They're learning about the 5 senses, and today they were focusing on seeing and smelling.
Well, this preschool is going to be a little different because we are providing not only education, but we are providing like meals for them. That's really a huge thing for their life, because a lot of schools that we have here in the country, they don't provide that. In addition to that, we are providing lunch, we are providing like health care when they need it. We're providing like all the notebooks and the backpacks that they need. Includes they have a little sweater they can use every day when they come to school. So it's really something that's really special.
Salud Y Paz is a faith-based mission. We want to be more than humanitarian aid. We also hope to facilitate spiritual, physical, and emotional health. When we have Christ, we have peace.
And the scripture comes to me and says, "To whom much is given, much is required." And I remember a line from a song that says, "If we could only forget our problems as easily as we forget our blessings." And so I want to ask you today, think about it in your life. What do you have more of? Do you have more problems in your life, or do you have more blessings? And I think you know the answer to that. And so I just want to ask you, will you help us keep the dream of Salud Y Paz alive?
To learn how you can help, visit saludypaz.org.